Good evening, everyone, and welcome back to another episode of HealthWise. I am your host, Dr. Joeann Davis, and tonight we're diving into something many have heard but few truly understand. Tonight we'll be discussing everything you should know about hepatitis. Also tonight we'll be featuring a medical official on our personality spotlight. We'll take a few minutes and we'll be right back.
Of sweet beverages in the Caribbean. It is time to shine a light on the dangers of sugary beverages. Sugar-sweetened beverages are the main source of sugar in our diets, and eating and drinking too much sugar has been linked to being overweight and obese. In St. Kitts and Nevis, 50% of adult females and 37% of males are overweight and obese. And 28% of children are either overweight or obese. A survey showed that 62% of students between the ages of 13 and 15 drank one or more carbonated sugar-sweetened beverage every day, exceeding their daily healthy limit. So, how much sugar should we consume? The World Health Organization and American Heart Association recommends that children aged 2 to 18 should consume less than 25 grams of sugar daily, and adults should consume less than 50 grams of sugar daily. It will surprise you how much sugar is in some of your favorite beverages. This chart shows that on average, one serving of a sugary beverage exceeds the daily maximum sugar intake for children, which is 25 grams, and is very close or sometimes over the limit for adults at 50 grams. The impact of sweet beverages on your health, your family, and community can be severe. So, it's time to rethink your drink. This message has been brought to you by the St. Kitts and Nevis Ministry of Health.
And you're back. Whether you're a student, a parent, or just health curious, by the end of this episode, you'll know the most essential facts of this group of liver diseases, what causes them, how they're spread, how to treat them, and how to stay safe. Let's jump to the basics. So, what is hepatitis? Hepatitis is inflammation of the liver, often caused by viral infections, toxins, alcohol, or autoimmune diseases. Now, there are five main types of viral hepatitis. These are hepatitis A, B, C, D, and E. So, how does hepatitis affect the liver? It damages liver cells, it impairs liver function, and may lead to liver fibrosis, cirrhosis, or liver cancer if chronic. Now, is hepatitis always caused by a virus? No. There are some non-viral causes of hepatitis, and these include drugs such as the overdose of paracetamol. And I know we use paracetamol for a lot of things like headaches, fevers, and stuff like that, but if we go over the recommended amount, we can end up leading to hepatitis. Also, the overuse or abuse of alcohol. Hepatitis can also be caused by autoimmune hepatitis and fatty liver diseases. So, can hepatitis be cured? Some can be cured, such as hepatitis C, whereas others are managed or prevented. So, let's jump into the first main type of viral hepatitis, which is hepatitis A. The hepatitis A virus is transmitted mainly via the fecal-oral route, meaning that, just in the name, via feces, and then it goes to the mouth. How does that happen? It's usually found in contaminated water or food. So if somebody is infected and they use the bathroom and don't wash their hands, and then they end up dealing with food or managing food, the food is now contaminated, and if given to someone else, this person can then contract the disease. Also, if you're drinking water that has been contaminated by a fecal source, once that water is ingested, then you are infected with hepatitis A. Now, what are some of the signs and symptoms of hepatitis A? Now, patients can experience fatigue, nausea, vomiting, abdominal pain, jaundice, dark urine, and pale stool. And when we say dark, we're not just talking about the typical dark urine from not drinking water or not drinking sufficient water. We're talking extremely concentrated urine. Now, is hepatitis A acute or chronic? It is only chronic. Hepatitis A does not cause chronic liver diseases. So some persons may ask, is there a vaccine for hepatitis A? The answer is yes. Yes, there is a vaccine for hepatitis A, which is highly effective, and it is recommended for travelers and high-risk groups. High-risk group being persons who are pregnant. Now, how is hepatitis A treated? So there is no specific treatment for hepatitis A. However, we do use supportive care and the rest, which tends to be, very effective. We'll take a quick break and we'll be right back, and we're going to discuss hepatitis B. We'll be right back.
It's time that we realize that we must work together to thrive.
The world as we know it, the sky and below it. Could I never have more wonder? Yeah, with life and all you see and the climate's changing.
But hope is remaining.
And we can't ignore the future. It depends on you and me. One chance, all that we got. One voice, together we stand. Take care, the world where we live. Permite a todos vivir. Tomamos la oportunidad para guardar la humanidad. And I must leave no one behind because we are one climate, one Caribbean. One climate, one Caribbean.
So we've just finished discussing hepatitis A. Now we're going to jump right into hepatitis B. Now, hepatitis B, how is it transmitted? Hepatitis B is transmitted through blood, semen, and other bodily fluids. So you can get it via unprotected sex, needle sharing, or from mother to baby at childbirth. Now, we all know how unprotected sex work, whether it's penile, vaginal, or oral sex. Once it's unprotected sex, you should be careful. Now, needle sharing, as the name suggests, if you use a needle that it's not sterilized, it's not clean, from one person to the other, if one of these persons are infected with the disease and then that same contaminated needle is used in someone else, that other person can become infected as well. Now, it's not just seen in a hospital area or anything like that, but for those who get tattoos done. So you know how tattoos work. They're in needles that puncture the skin and put ink into the skin so that the tattoo appears on the skin. Now, if in a situation where the tattoo artist isn't as clean as we would like him to be, or he doesn't sterilize his tools properly and then uses his needle onto someone else, that's how you can get it, right? So persons who are most at risk for hepatitis transmission via needle sharing, persons who work in the labs, for example, the phlebotomists, persons who work in the dental offices when they have to deal with needles and stuff like that, and blood, doctors, nurses, all these people are at high risk. Persons who go for tattoos, because you like your tattoos, and there's nothing wrong with getting a tattoo, but you should also be very, very careful when it comes to stuff like that, right? And from mother to baby. Now, if a mom is infected with hepatitis A, the child can get it not while it's in the abdomen, not while it's inside of her, but during childbirth. During childbirth, there's a lot of exchange of fluids, of blood and stuff like that, so the baby can get it via that route. Now, can hepatitis B become chronic? The answer is yes, especially when infected at birth or early childhood. So chronic infection can lead to liver damage. As I said before, babies who are born from an infected mother, they are most at risk of getting chronic hepatitis B. Now, is there a vaccine for hepatitis B? I remember on our last show, when we spoke about antenatal care and we spoke about vaccinations and all that stuff, we did mention that yes, there is a vaccine for hepatitis B, and that vaccine is usually administered at the time of birth and throughout infancy and childhood. So most persons should have already gotten their vaccine for hepatitis B. And it is a standard in most countries that hepatitis B be given to protect the population. Now, how is chronic hepatitis B treated? The answer is with antiviral medications like tenofovir or entecavir, which suppresses viral replication. Basically, these medications are given to someone who has hepatitis B, and what it does, this medication, it stops the virus from replicating, from multiplying in the body. Right? So once this is done, then it minimizes the amount of virus that is inside the body, and therefore it reduces the symptoms of hepatitis B. Now, how is hepatitis C transmitted? You see, we're moving on pretty quickly because this group of viral liver diseases are very common, right? And they're grouped together, so you can't really differentiate it just based on their symptoms, but based on their viral code or DNA. Now, hepatitis C is transmitted primarily through blood-to-blood contact, such as needle sharing or unsafe medical practice. So it's very similar to hepatitis B in the way that it's transmitted, but it's not the same. Now, can hepatitis C become chronic? In 75 to 85% of cases, acute cases become chronic if left untreated. So if you have these signs and symptoms and then you kind of ignore them, you won't know exactly what type of hepatitis you have. You may have hepatitis C, and then if left untreated, it can become chronic hepatitis, leading to liver damage. Now, is there a vaccine for hepatitis C? The answer is no. As of 2025, there is no vaccine for hepatitis C. However, the upside is that hepatitis C is curable. By using direct acting antiviral treatments, hepatitis C can be cured, and it has been shown to be very effective in over 95% of cases, which usually resolve within 8 to 12 weeks. So although hepatitis C does not have a vaccine, unlike hepatitis A and hepatitis B, hepatitis C is curable. Now, what are the long-term effects of untreated hepatitis C? Like I said, it can lead into cirrhosis, liver failure, hepatocellular carcinoma, and that's just the fancy medical term for saying liver cancer. So if you leave it untreated, and I don't understand why you would leave it untreated, seeing that it is curable, you can cause yourself to end up getting liver cancer, right? Fibrosis, cirrhosis, liver failure. Now, we're going to move on into hepatitis D. But before we get into that, we're going to take a quick break and we'll be right back.
Another day in the books. Well, hello there. Ooh, she pretty from head to toe, and are you ready to go? Wait there. Whew. Can't afford to slip up. Not even in my dreams.
And welcome back. So now we were just discussing what is hepatitis D and how is it transmitted. Hepatitis D is like hepatitis B, is that it's transmitted through blood and body fluids. So can hepatitis D be prevented? Yes, indirectly by vaccinating against hepatitis B. So remember I said that this group of hepatic diseases are grouped together, meaning that they're very similar but at the same time different. So if you have your hepatitis B shot, you are already indirectly preventing against hepatitis D, right? Which I think, it's pretty cool because you get a 2-for-1 combo. Now, is there a treatment for hepatitis D? It is very limited, meaning that we do have a medication that is used, but response rates vary. So we're in the process of, developing a treatment that is specific for hepatitis D. Now, there isn't much discussed on hepatitis D, because as we said before, it's closely related to hepatitis B. So we're on our final one, hepatitis E. What is hepatitis E and how is it transmitted? Just like hepatitis A, this virus is transmitted via the fecal oral route, often through contaminated water, and it usually causes acute infection, meaning that just like hepatitis A, if somebody is infected with the disease and they deal with food, or they put, how children play, they put their hands in their mouth, they share snacks and stuff like that. And unfortunately, not all of our children, or when they're young, they tend not to understand the importance of hygiene and the importance of washing their hands after using the bathroom or touching different things, right? They put their hands into the mouth and that's how they're infected, and then therefore they spread it. Now, again, with the contaminated water, that is why we highly advise that you boil your water. If you're drinking pipe water, boil your water, filter it, take all the necessary precautions against it, right? Now, can hepatitis E become chronic? The answer is really. It really becomes chronic, but it can in immunocompromised individuals. For example, those are people who've had organ transplants, or those who have things such as HIV, those who have cancer, basically anyone whose system or whose body system of defense is weakened by some other diseases. So we might call it an opportunistic virus, okay? That is how it can become chronic, but majority of the times it's very acute. Is there a vaccine for hepatitis E? A vaccine exists in some countries such as China, but it is not widely available globally, meaning that some countries like China, they have a vaccine for it, but in the rest of the world, not so much. So who is at risk, or who is most at risk for severe hepatitis E? This might surprise some people, but it's actually pregnant women, especially in the 3rd trimester, are at a higher risk of severe outcomes. During pregnancy, and we spoke about this during the previous episode about antenatal care, During pregnancy, the body is at a weakened state because the woman's body is trying to nurture a baby, an unborn child. Now, if her defenses are low, it therefore means she's at a higher risk of being affected by hepatitis A. Now, how is hepatitis diagnosed? Now, we were just discussing the types of what you expect to see according to the symptoms and signs of hepatitis, and we went over it. There were fatigue, nausea, abdominal pain, jaundice, dark urine, and sometimes fever or joint pain. Now, if you notice any of these things and you can't recall, okay, did I do anything that may have been out of my norm? Why am I experiencing these things? You should definitely go and see a doctor, and don't just think that, okay, it'll just wear off on its own. Sometimes they can, but it's always best to be safe than sorry, you know. So you're feeling tired all the time, you're feeling the urge to vomit, you have pain in the abdomen, you're realizing that your skin is yellowing around your eyes, under your tongue, or the palms of your hands or the sole of your feet. Or if you have a lighter skin tone, you're realizing that you're looking a bit yellow. That is jaundice. You're realizing that you have dark urine and you're feeling like you have a fever or you have pain in your joints. If you have a group of these symptoms, definitely go and get checked out. So how do doctors know, okay, this is definitely hepatitis? So first we do blood tests, obviously. So you go to the doctor say, you know what, we're going to run some labs on you. And what they do, they take off blood, and the first thing they're going to look at your liver enzymes, right? And specific viral markers. Now, if these liver enzymes, if their range, or if what the levels in your blood are at an extreme, we can pinpoint that yes, you have hepatitis, and this conclusion comes with the addition with the symptoms that you are experiencing. Now, can someone have hepatitis without symptoms? Yes, there are cases where patients are asymptomatic, and the only way they know this is through a blood test. That is why we highly recommend getting a general checkup once a year, maybe twice a year, but getting a general checkup, not just physically, but getting your labs done as well. This will help you pinpoint if you have any diseases that you're not showing signs for. That's what asymptomatic means, meaning that you don't have any symptoms, you're not presenting any symptoms, you feel perfectly fine, but there's something going on inside of your body that you should pay attention to. Now, what is jaundice and why does it occur in hepatitis? As I was saying, we refer to jaundice as the yellowing of the skin, and we see it in the palms of our hands, we see it under our eyes, in the mucous regions, under our tongue, right? Sometimes you see it on the lip, you see it under the sole of your feet. And in lighter skinned persons of a lighter complexion, it's more easily visible, but in darker persons, you see it on the palms of the hand, the sole of the feet, especially under the tongue and under the mucous membranes of your eyes. Now, how does it work? So this yellowing of the skin is caused by a buildup of what we call bilirubin, which is a result of liver dysfunction. So hepatitis, it affects the liver. It's inflammation of the liver. So it affects the liver and causes what we call bilirubin to build up into the body. And why does bilirubin build up? Because the liver is not doing its job anymore. The liver is unable to function as it normally would if it was healthy. So all this bilirubin is in the blood and it's circulating around, and then it causes that yellow pigmentation of the skin and everything else that I just mentioned. Now, can hepatitis be spread by casual contact? Only hepatitis A. Now, like I said, hepatitis A can only be spread through contaminated food, contaminated water, right? Contaminated hands. If you do not have the habit of washing your hands frequently or washing your hands before you eat, This should serve as a warning to get you in the habit of washing your hands. And some people be like, but every time I wash my hands feel dry. We have detergents for a reason. You can use detergents, moisturizers to keep the moisture locked in. But washing your hands is so important because it prevents you from being infected by so many diseases, hepatitis A being one of them. Now, hepatitis B and hepatitis C are not spread by hugging, sharing food, or casual contact. I know sometimes because we're trying to preserve our health, we may indirectly discriminate against someone who may be sick with something else, with something like hepatitis. And yes, I agree, it's always better to be safe than sorry. But these are some of the myths that are debunked. You cannot get hepatitis B and C via hugging someone. You cannot get it by sharing food or, just casual contact by shaking their hands or touching something that they touch. It doesn't work that way. Only hepatitis A is spread that way through contamination of hands. And our hands go everywhere. Our hands touch the doors, our clothes, doorknobs, food, wrapper, everything our hand touches. So that is why it's so important to keep our hands as clean as humanly possible all the time. Now we're gonna take a quick break. I think I've been talking for a minute on end, so we're gonna take a quick break and we'll be right back.
Every smile, every hug, every step our children take is a precious gift. For 50 years, vaccines have been the shield protecting those moments, saving 6 lives every minute around the world. That's 8,000 lives a day. Thanks to Vaccination Week in the Americas, 1.2 billion people have been vaccinated across more than 40 countries. In 2024, we celebrated 30 years without polio and reaffirmed our region's status as measles-free. But there's still more to do. For 2030, PAHO has set the goal of eliminating more than 30 communicable diseases. This goal is about caring for our future and for our communities, our health systems, and boosting socioeconomic progress. One of our top priorities is to become the first region in the world to eliminate cervical cancer, a disease that took more than 40,000 lives in 2022 alone in the Americas. To this end, PAHO supports countries in reaching at least 90% vaccination coverage rate for the human papillomavirus in girls under 15 years of age. Also, some countries are already vaccinating boys, which will help achieve the overall goal. But there are still children and adolescents without access to vaccines. We need urgent support from our leaders, our communities, and from each individual. No child, no one should suffer or die from a disease that we know how to prevent. Why is getting vaccinated essential? Because each person vaccinated is a life saved, a step closer to individual, family, and community development. Because your decision makes a difference. For those you love, for the future, for your health, and for the good of your country and our region.
And we're back. Right now we're going to take a quick moment to see our personality spotlight featured Dr. Ruben. Let's take.
Our medical personality is Dr. Quincy Ruben. Hailing from Sadler's Village, Dr. Quincy Ruben is described as a dedicated medical professional. In 2015, Dr. Ruben graduated from the University of Granma in Cuba with a Doctor of Medicine degree. Upon returning home, he began his career as a medical officer in the emergency room in October of 2015, where he served diligently until November 2022. He then transitioned to community-based health services and currently serves as the District Medical Officer, or DMO, for the districts covering the villages from Keys to Mansion. His role also includes being on call 24/7 for matters related to deaths and sexual assault cases that may occur in the district. Dr. Rubain is a strong advocate for the use of the health centers, reminding the public that each district has access to free healthcare services. Our medical personality is Dr. Quincy Rubain.
And we're back. Now, before we continue with our discussion, I have some very interesting news to share. The BPW Layamiga is funding a project called Her Flow, whose objective is to educate and help persons, females, in the high school and late primary school, and to teach them about how to take care of themselves during the menstrual cycle, what is the menstrual cycle, and everything, all debunking all the myths and everything concerning the menstrual cycle. So BPW Layamiga is hosting an event called the Nights of the Arts, which is going to be hosted at the Meltaway on Walden Street on the 21st of this month. Now, admission is completely free. However, they are looking forward to a donation that would help to further this project. I think this project is very, very important, something that we should all try to be a part of. When it comes to educating our young population, this is something that has, this is a topic that has been a taboo for years now, but we're living in a society now that we're more open-minded, we're more eager to learn new things, and I think it's very important that our children should know what is the menstrual cycle, how to take care of the bodies during that process, and it's something to not be scorned of or to be ashamed of. All right, so on the 21st of this month at the Meltaway on Walden Street, they'll be having the Night of the Arts, where you can come showcase your talent, sing poetry, spoken word, whatever it is, and donate to Her Flow. Now let's get back into hepatitis. Now, hepatitis, we just discussed whether hepatitis can be spread via casual contact, and we debunked a few myths saying that hepatitis A is the only one that can be spread via contact with an infected hands or food or water, and that hepatitis B and C are not spread via casual contact. It is not spread by hugging, sharing food, or anything like that. Now, what are some of the safe practices to prevent hepatitis transmission? Now, as we said, first and foremost, wash your hands. For hepatitis A, wash your hands, keep your food and your food surfaces clean. Remember that it is transmitted via fecal oral transmission, and this is something that it can be prevented by washing your hands, being careful of how you treat food. Now, when it comes to water, I know that sometimes there isn't much we can do with the water that comes out of our pipes, because you wouldn't know whether it's passing by a fecal source, you wouldn't know whether it's contaminated with something. However, what we can do, we can boil our waters, and then we can filter them, or if you're able to, you can buy bottled water. That should be the surest way to help you to prevent getting hepatitis A. With regards to hepatitis B and C, D, and E, well, as we spoke about hepatitis A and E are the two that are transmitted via the fecal oral route. But hepatitis B, C, and D, no, we have to be very cautious when it comes to that, meaning that it can be shared via bodily fluids, right? It can be spread via bodily fluids. Now, how do we protect against that? When it comes to sex, always make sure that you are protected, or it's always best to get you and your partner tested for it. Okay, so you're tested. If you're not tested, you're not sure, always use a condom. Protect yourself, protect your partner. Then we can, when it comes to needle sharing and stuff, we don't recommend you, first of all, we don't recommend the population to be using needles. Once it's used, you discard it immediately. So patients who are diabetic and you have to take your insulin, once your needle is used, you dispose of it. You cannot share your needle because somebody else don't have a needle for their insulin and you're going to give them the one that you just used. You don't take that kind of chances. Once your needle is used, you dispose of it and you take the necessary measures. So it's not just about injecting yourself, but accidental injections can occur. For example, if you dispose of your needle incorrectly, as in you did not cover it as you should and you just toss it into the garbage, someone who may be disposing that garbage can get themselves infected by getting cut by it. So now it's not just about you and the persons that you're closely related to, but think about those who dispose of the garbage, those very important people, persons who work on the garbage truck, those persons who work in the landfill. These are very essential people to our society and we have to try to protect them. Obviously they're going to use the necessary means of protection, but accidents do occur and our objective is to minimize that from happening. Then persons who get tattoos and stuff done, it should be a priority that tattoo artists, tattoo parlors make sure that they sterilize their equipment, make sure that they are handling their equipment the way that they should. Also they should make sure that once dealing with a client, once that client is finished, you immediately take your equipment, your needles, whatever the case may be, you put them away to make sure that they're certainly not mixed up with something else that should be used for the next client. You don't want any cross mix-up matching story going on, right? Those who work in the labs, the phlebotomists, nurses, doctors, we are all at risk of getting contaminated or getting infected by an accidental pricking. Now, we should all try to be mindful of such things happening, and I don't think anyone would want to give themselves hepatitis or want to be infected by that, but it is very important that we take the necessary precautions. We dispose of our needles as they should be disposed in the proper bins or the allocated bins for them, and we try to be very cautious with it. Okay. Also, by maintaining hygiene when traveling. Sometimes we travel, we get so excited about the trip and all that stuff, but we have to bear in mind, you have to keep in mind the type of country you're going to. Is your health system up to par to where you came from and the necessary means? Don't get overly excited and you throw all caution to the wind, but keep that in mind. Okay. Also ensure that, well, we can't, the population can ensure it, but the labs ensure that the blood for transfusion is okayed for transfusion. As we know that hepatitis can be transmitted via the blood. If you give someone contaminated blood, they will obviously get it. So in the labs, we try to make sure that the blood is clean. We run a lot of tests to it. If the blood is contaminated with anything, the blood has to be disposed. So I'm going to use this opportunity to encourage persons to donate blood. We, the blood bank, we need blood in order to save lives. If there's no blood, there's not much we can do. So please go out, donate. It just might be you saving your own life in the event that something happens and you're the one on the receiving end. Okay. Now, can pregnant women transmit hepatitis to their babies? Yes. We discussed this in the fact that during childbirth there is a lot of mixture of fluid taking place, and yes, babies can become infected with it. However, we do have the hepatitis B vaccine, which is given shortly after birth, which helps to prevent against it. It helps to prevent against chronic hepatitis as well, which would therefore lead to liver damage. Now, what is cirrhosis and how is it linked to hepatitis? Now, I know you've been hearing me saying the word cirrhosis for majority of this show, and some persons might be asking, what is cirrhosis? Now, cirrhosis is basically the medical fancy term for saying scarring of the liver. So this is where the liver end up getting like scarred tissue on it because of hepatitis viral hepatitis such as what we discussed, or abuse of alcohol. You might hear it with regards to alcohol abuse, but it can also be associated with drug abuse, such as an overdose of paracetamol. Now, hepatitis cirrhosis is often caused by chronic hepatitis, and when we're talking about hepatitis, we're mostly referring to hepatitis B or C, and it can lead to liver failure. Now, how can liver cancer be related to hepatitis? Chronic hepatitis B and C significantly increases the risk of hepatocellular carcinoma, which is fancy medical term for liver cancer. All right, and once this happens, once this happens, what cause it leads to liver cancer, causing the breakdown of the liver, causing a decrease in its function, and then everything goes haywire after that. Now, when should someone see a doctor about hepatitis? If you are exposed to hepatitis, if you experience symptoms like jaundice or have risk factors such as IV drug use, unprotected sex, or abnormal liver tests, definitely go and see a doctor. It is very important that you do, to protect yourself and to protect others. Now, a quick recap: we learned that hepatitis is inflammation of the liver. We learned that there are 5 main types of viral hepatitis, which are hepatitis A, B, C, D, and E. And we also learned how they are transmitted, if they have a vaccine or not, if they can be cured or not, how they're managed, and how they are diagnosed. We also learned the importance of prevention, mainly washing your hands, and taking precaution when it comes to needle sharing. We also focused on the importance of learning about these things. Now, a lot of people I know, they may have heard the term hepatitis before, but are not fully aware or understand what exactly it is. I'm hoping that this helps you to understand. So the help tip of the week is hepatitis. Know it, face it, stop it. Again, hepatitis, know it, face it, stop it. It was a great pleasure being with you all here tonight, and we're going to see you back on the next episode of HealthWise. Good evening, everyone.